We're here on the site of the St. Jude Hospital, the refurbished St. Jude Hospital at Auger in Vieux-Fort, where the finishing touches are now being placed on this new hospital as it prepares to take on patients with new equipment coming in and the stage being set for the grand reopening of the St. Jude Hospital. On November 1st, 2022, preliminary works began on the new phase of the St. Jude Hospital Reconstruction Project. The Philip J. Pierre-led administration had embarked on a different path from the one undertaken by the previous administration. That decision was based on the conclusions of a group of experts tasked with recommending the way forward for the beleaguered project. The government of St. Lucia secured a loan of $75 million from the Saudi Fund for Development for the completion of the St. Jude Hospital. Reno Construction was contracted to undertake the project. Fast forward to November 2025 and construction works on all of the buildings are reportedly completed. St. Jude in many ways has been a marathon and not a sprint, but with the finish line in sight, the division is far from over. We visited one of the central buildings on the site. This building houses the kitchen on the ground floor. Workers were busy fastening various fixtures and putting kitchen equipment in place. We later made our way to the top floor, where the hospital's administration will be housed. Once again, major works were completed. Crews were tidying up. The physiotherapy and dialysis centers were in a state of readiness. At the hospital's laundry, we caught up with the mechanical engineer who worked on the second phase of the St. Jude Hospital Reconstruction Project. He was asked about the status of the project.
Well, nearing completion, we're at this stage, maybe 98-99% complete.
In terms of time, what does that mean?
Time?
Yeah.
Well, if we're talking about in terms of time, we're looking at possibly the building is going to be ready by the end of next week.
Ajit Singh is one of the civil engineers on the project. He says it is now a matter of waiting for the arrival of medical and other pieces of equipment which are expected to arrive soon.
The laundry is completed 100%. The physio is only some medical equipments are not there, but the 98% that's also done. The same thing with the dialysis also. And the office area, administrative area is finished already, 100%. The kitchen is balanced, which I told you already that we are trying to finish that also 100% up to the 12. Okay. And the surgical and the east wing is finished in terms of the furnitures. But if we are talking about the new medical equipment, that is balanced, which need to be, I think they will become mid or last of this month.
Silas Wilson has served as the liaison officer for the St. Jude Hospital Reconstruction Project. He confirms the imminent arrival of the final pieces of the puzzle.
The last big hurdle that we have to overcome, which we should overcome very soon, is the arrival of medical equipment into the country, which we are going to install in the spaces, because the spaces are actually waiting now for that medical equipment to come in. But we are very happy to report to St. Lucia that the long wait for the St. Jude Hospital is almost over. We are almost over that hill. We can actually see the top of the hill. And it's just a matter of time before the equipment gets into St. Lucia. We believe in the next few days we shall start to see the equipment arriving on site.
The question on the minds of many is when will the actual transfer begin? Those who are in a position to say seem guarded, avoiding pinpointing a date.
We are happy to report that a substantial amount of work has been done. The buildings are more or less completed and are ready to receive equipment. If you walk around, you will see that furniture is being installed, both loose and fixed furniture. The laundry is ready for operation. The kitchen, in a few days' time, will be ready for operation. Admin staff are moving very shortly. Physiotherapy, we are almost ready to receive the physiotherapy staff and the patients from the St. Jude Hospital. And there are a number of other areas where a lot of work has been done and that the facility is ready to receive services, to provide services to the public from this site here.
Based on the information from the various professionals involved in this project, the migration from the George Odlum Stadium to this site at Auger is expected within a month. But some of the final steps, like the arrival of equipment, are not within their control. No doubt the discussion about St. Jude will continue long after this project is over and opened. But for the people who are going to be directly impacted by St. Jude Hospital, the opening is going to be creating a great relief. Stanley Lucien reporting from the St. Jude Hospital Project site in Auger, Vieux-Fort for the HTS News Force.